Welcome back, everyone. I hope you had some time to enjoy the sunshine and get out and about, eat a bit of food, and really delighted to be sharing this afternoon with Kim Loo. I was reading a bit about your bio and really impressed with not only your chair position, everything you're doing with Doctors for the Environment, and just your home life as well with the solar panels and the chooks. And yeah, you're really walking the talk on a big scale and at home. So really excited to share and hear what you were about, Kim. So over to you, and here to host any questions ongoing.
Okay, thank you so much. I live and work on the land of the Darug Nation. Just want to make sure, can you hear me?
Yep, we can, and I think we've got your video
Okay.
lined up if you'd like us to show that, or maybe you'd like to do an
Let's
introduction.
show that first. Thank you.
Perfect, too easy. We'll just play that now.
Australia needs to act on climate change because our population is really feeling the impacts of climate change. In Western Sydney, where I work, the temperatures have hit close to 50 degrees. The impact on my patient population has been devastating. If we actually don't do anything about adaptation or mitigation, Western Sydney will not be livable. As a doctor working on individual patients, I could see that it was impossible for me to actually help my patients. So I tell patients, what you eat, what you drink, how you live, how much you exercise determines how healthy you are. When I could see that the heat and the air pollution was beyond my control, that it's a systems problem that requires a systems solution. Our health is inextricably linked to our environment. We need clean air, clean water, healthy soils, a stable climate and a healthy ecosystem for us to be healthy. Climate change is impacting our population now and is the greatest threat to our public health. We know this. We know the benefits of transition are enormous for the health of our community. A better future for Australia is for Australia to use its abundant renewable energy. We have enough wind and sunlight here to power the whole of Australia, and the technology for storage is rapidly improving. The possibilities are infinite. We want to lead in this race to have a healthy future. I want the whole community to benefit from this transition so no one is left behind and no one is left out. This is entirely possible in Australia. We just need the imagination and the desire to do this from all sectors of community, including our government.
Excellent, Kim. Over to you.
Oh, thank you. So yes, I live and work on the land of the Darug Nation, and I've been practicing in Western Sydney for 32 years now. I have 2 children, one in university and one still in high school. And Western Sydney has 9% of the Australian population, and we have the largest population of our First Nations. We speak 121 different languages, and we are sitting in an area that we see is at the extreme end of climate change when it happens. So now, can we do the next slide? Oops. So this word solastalgia has been coined up by environmental philosopher Glenn Albrick. And it means that there's a homesickness you get when you're still at home, when the world around you is changing. So this is a photo from Windsor. I work in Riverstone, which is close to Windsor, and I'm surrounded by areas that have been built on that are flood zones. And it is a clear reminder that Australia is the most climate vulnerable first world country, and that we need effective measures to protect
our community. Now, climate change, can we do the next slide? So climate change impacts our environmental determinants of health. So clean air, clean water, a healthy climate, stable climate, and a healthy ecosystem, and stable and healthy soils. Our health sector that recognises that we have a public health crisis secondary to climate change. And the Australian Medical Association declared a climate health emergency in August 2019. And subsequently, we have our colleges of general practice, emergency medicine, physicians, obstetrics and gynecology, psychiatry, and rural remote medicine who recognise that we have a public health crisis on our hands that's developing. Next slide. So I want to talk about the direct impacts of climate change heat first. And it is the silent killer. More people have died from heat than all other natural disasters in Australia. And this is still under-recognised as a public health crisis. Next slide. So when we talk about, when you hear in the news that we're trying to prevent our average temperatures going up by 2 degrees, it doesn't sound like much. But what happens is that if this slide, if you look at this graph and it moves to the right, and normally in the illustration does move to the right, you can see that you will get an increased number of heat days. And in, can you move this next slide, please? And you can see that our temperatures are actually trending up. And we do get years that are cooler, but the general trend is going up. And during the 2019-20 summers, Western Sydney reached 48.9 degrees. Next slide. And we are also hot because of the built environment. This is a bird's eye view of one of our suburbs in Western Sydney called Rouse Hill. You can see that there are black roofs houses sitting right close to each other. So there's no option in terms of planting trees and having more greenery to actually cool the area down. And we know that if you have black roofs, it actually increases the temperatures within the household by 4 to 10 degrees. And so our built environment makes a huge difference. And at the moment, there's so many areas, and it's actually the poorer areas of all our cities where houses are built that don't protect our population. Next slide. So who are the most vulnerable in terms of heat? Everyone is vulnerable, but I've put a list of people who are more vulnerable here. So we know that community cohesion actually protects our society. So if you have a network of friends and family, you're more likely to be protected during climate change or any crisis. So if you're isolated, you're poor, or you're homeless, you're more vulnerable. We know from heat waves in 2013 in Adelaide and Melbourne that more people died over the age of 65 than any other age group. Infants and children are more likely to dehydrate, and because they have less ability to thermoregulate. Our pregnant women and who are breastfeeding are also more at risk. People with pre-existing medical or cardiac or respiratory conditions. And also our mentally ill, our outdoor workers who don't have any option but work outside during hot days, and our school children. We know from studies done in Western Sydney that, and most of our schools in Western Sydney aren't air conditioned. And we know from studies done on school playgrounds that they're the hottest places in the school. And we know that children actually learn best at 22 to 25 degrees. And when you have hot schools that don't have air conditioning, you're impairing our children's ability to learn. Next slide. So our young children are also vulnerable because with our built environment, this is especially true in Western Sydney. I'm not sure how true it is in Dandenong. We have the built environment there is a lot of concrete. There are very few parklands and shaded areas with trees that are safe for mothers to take their children out. We know that a lot of school playgrounds are hot, they're made out of metal. And Professor Sebastian Fauch, who measures ambient temperature around playgrounds, has found that in some playgrounds on 30-degree days, the surface temperature of the playgrounds are 90 degrees. So the built environments are more likely to traumatize our kids. I'll get you to change this slide. So this is a snapshot of what's happened in Western Sydney during the 2019-2020 heat waves. Maximum temperatures reached up to 2 degrees above the temperatures, which means it's hit what we're trying to prevent already in terms of the Paris Agreement. And in Western Sydney, we had 37 days over 35 degrees, which is really dangerous because if you have days of a heat wave where you have days and days of hot temperatures and you have an urban heat sink, people and houses do not cool down overnight, and that increases the risk of death. And Penrith was the hottest place on earth for one day at 48.9 degrees. Next slide. So what happens when it's hot? Our bodies are meant to be regulated between 35.6 to 37.8 degrees centigrade. If we're a little bit dehydrated, and we can become dizzy and tired and irritable, we can get muscle cramps, and all this can cascade into heat exhaustion, and we can have headaches, muscle weakness, have a fast pulse, fast breathing, cool, moist skin, and this can rapidly lead to heat stroke when the body loses its ability to actually regulate temperatures at 40.5 degrees, and this is a medical emergency. And so you can actually commonly see people who on hot days who are slightly dehydrated. So sometimes if you see someone who's a little bit tired and irritable, it mightn't be that they're a cranky person. It could mean that they're actually dehydrated. And our body's ability to actually detect how much we should drink is not very good. So normally the body cools down by sweating and by moving blood from our heart to our periphery so that we can cool down. So if you have heart disease, or you have a disease that prevents your blood from easily getting to your hands and your feet, and your heart is pumped, and there's a lot of people, unfortunately, who have heart failure because a lot of people now with medical advances have survived heart attacks. And if their heart can't pump effectively, they're more likely to get a heart attack. Next slide. And we know with mental illness, it's more common during heat waves because, like most other people, heat disrupts our sleep. And if you don't have an air-conditioned house, or you're too afraid to turn on the air conditioner, it can disrupt your sleep. We know that increases the risk of domestic violence because the police have records on this. And it's also more isolating because if it's hot outside and you have air conditioning inside and you don't have connection with lots of family, you're isolated. It reduces fitness because in Western Sydney, there's no place to go outside and exercise. And we know it's linked to increased suicide rates. Next slide. So we also have medications that can interfere with people's ability to cope with heat waves. We have medications for heart failure that can interfere with sweating, alter your thermoregulation, make you more dehydrated. Children, we think of old people with medications when we think of heat waves and the impacts, but kids who are on medications for anxiety, depression, or ADHD can also be affected during heat waves with their ability to thermoregulate and to sweat. Next slide. So how's our population managing with dealing with the heat? This is a little bit of an old study. It was done in 2018 in Western Sydney and the North Coast, where they actually looked at 250 households and 60 businesses. And they found that even with simple education before the study, 45% of people didn't actually take measures to cool down, and 20% of people didn't turn on their air conditioners. And at this point in time, it's possible that we are still at this phase where the population truly doesn't understand the problems with heat. Next page. Now, I'm going to move on to the next topic, which is air pollution. And you can see from this picture where we have the coal mine and the motor vehicles and the point of extraction. There is a lot of air pollution just from mining, transporting, moving, combusting fossil fuels. Next slide. So in terms of air pollution, this is my local air pollution. This is along Windsor Road in the hills. And I was driving, I got my daughter to take the picture. And you can see the air pollution and the particulate pollution. Next slide. Now, this is a little bit of a complex slide, but air pollution is like a big soup. So you have lots of different particles in the soup. Some of them are solid and some of them are liquid. And so in terms of the solid particles, we divide them into bigger size particles, which is called PM 2.5. PM 10 microns, and PM 2.5, which is 2.5 microns. Now, next slide. Sorry. Forward. So when you compare the size of what 2.5 microns is to a hair, you can see it's really small. So these solids, really small particles can actually, we breathe it in and can go into our blood vessels and go to every single part of our body. And that's why these small particles, which could be anything, is this a particle size? It could be anything, like particles from car pollutants and from bushfire smoke and from coal-fired power stations are toxic. And if you breathe them in, we know from studies, there have been long-term studies from America for the last 40 years, we've got studies in New South Wales, is that it increases the risk of asthma, increases the risk of heart attacks and strokes. We know that it also increases the risk of type 2 diabetes. It can impact the growth of babies if mothers breathe this in for a prolonged period of time when they're pregnant. And next slide. So we actually do have studies in Australia where we look at car pollution and how it impacts kids. So this is the Australian Child Health and Car Pollution Study, which was started in 2012 and was completed in 2018. So we had schools in every single state in Australia except for Tasmania who were within 2 kilometres of an air quality monitor. And so what the studies did was they measured the nitrous dioxide, which is what we look at for car pollution, how much those kids breathed out, and that's easy. And they also measured the lung function for the children. So these were children between the ages of 7 and 11. So with these studies, it showed that if kids are in schools that are next to major highways, it increases their risk of asthma. And this is a really robust study. Next slide. Now, this is the Barcelona car pollution study. With this study, they looked at kids again between the ages of 7 and 11 and looked at schools that were close to highways and away from highways. And they found that children who were in schools close to highways it actually impacted their cognitive function, or their ability to learn, and their ability to think through processes. So we know that children are impacted with their lungs and their brains with car pollution. Next slide. So it is, sorry. So what can we do about climate change? Because I spent years, now this is the 32nd year I've worked as a doctor, and I've only been in advocacy for the last 6 years. So I spent those years watching Western Sydney get hotter and hotter and more polluted, because we have more cars on the roads now. So it kind of makes you powerless. So it's really hard and overwhelming when you see what the problem is and you feel powerless. But there are ways that we can things that we can do that will help change the system, because it is the system's problem. And these are some of the things I've done at home and I've suggested to my groups. One of the easy, I'm trying to look at ways that you can actually change what you do without spending too much money. So one thing is to move your money out of banks and super funds that invest in fossil fuels. There's a website called Market Forces that goes through all the banks and super funds to give you a good picture of which ones invest in fossil fuels and which ones don't. So, for example, Bendigo Bank and Bank Australia don't invest in fossil fuels at all. But all the other major banks do. So it's a simple thing to do, because if you go to Market Forces, it'll give you really clear steps on how to leave your fossil fuel bank. Now, eating less meat. We know that most of the deforestation on this planet is due for meat production. And we know that through studies from the medical field that eating less meat is actually good for your health. So you can choose to, like my family is now vegetarian, but you don't necessarily have to become vegetarian. You can have one meat-free day, just have more plant-based foods. And the other thing I've done is I've always been a gardener, but I'm a gardener in a major way now. And I've got chickens. So, but if you don't have a garden, most communities will have a community garden. And gardening is really good for the soul and really good for the health. And there's lots of studies to show that now. And active transport. If your community has good public transport, use it. I live in the hills of in New South Wales, and we have great public transport. So I tend to leave my car at home when I'm not going to work and go everywhere on public transport. Walk or cycle. It's really good for your health. And join a group, because it's really isolating when you kind of start realizing how climate change is really impacting your own health, the people around you, and where you live. If you actually join with a group of people who understand the problem, it actually helps you cope through the stress of that. Next slide. And we have been doing this for quite a few years now, buying secondhand clothes. Because we know that the fashion industry has a large carbon footprint. It's said it's comparable to the airline industry. And clothing, and so I've taught my daughter to sew, and thrifting is now the thing to do for her age group, which is great. And reducing waste. And this is a really hard thing to do because plastics are everywhere. If you have the opportunity, and sometimes it's where you have the options to go to a bulk food store. When I say bulk food store, I mean stores that actually have things in big buckets that you take your containers to, because that way you can actually reduce packaging. I do laundries and shampoos this way as well. And insulate your home. You can do it. I started really cheaply by putting bats in the roof, but planting trees and putting blinds and awnings can make a huge difference. Next page. And exercise your democratic right. In Australia, a lot of people have disengaged from actually with democracy. Like most people don't know who their local councillors are or who their state member is or who their federal member is. But if you live in that person's electorate, they have to actually listen to you, and answer your mail. So write to your local member about climate change and how it's impacting you and your community. And writing is more useful than sending an email. It's harder to ignore a piece of paper in front of you than it is with an email. And most politicians will actually send out newsletters about what they're doing for the community. Reply to the newsletters. Find something in a newsletter that links to the environment or to climate change and send it to them. They also have to reply. And organize, this is with your group, organize a meeting with your politician who's whether it is your local council member or your state member or your federal member. I've been doing this for the last 6 years and all my local members know me now. Next slide. Okay, so these are all the organisations I'm with. Now, I advocate for everyone to join Australian Parents for Climate Action. Even if you're not a parent, you could be an auntie, a grandparent, an uncle. It's free to join and we've got 14,000 members now. And the more members we have, the more powerful we are when we go lobbying. Next slide. And okay, actually next slide, sorry. Now, this is just to give you an overview of what I'm doing with Doctors for the Environment. It's a little bit of a complicated slide. So I've been lobbying for 6 years at all levels of government. So at the federal level, we've been advocating for climate and health and change, a framework to deal with climate change. Nothing's happened yet. On the state level, all my groups write submissions for fossil fuel projects because they're always in line, and the more submissions that say we don't want this fossil fuel project, the better. And what we've also done is lobbied for tighter emissions for coal-fired power stations because we actually have the poorest emission standards for our coal-fired power stations. And lobbying for submission for the Clean Air Act and lobbying for sustainable healthcare because 7% of our emissions are from the health sector. And with Australian Parents for Climate Action, we're advocating for solar our schools. And at the local council level, we're actually asking for our council to join the city's power partnership. Next slide. Okay, this is my home. These are my kids. These are the eggs from my chickens. So I have been lucky to have the option of actually doing all the stuff I want to at home. My garden's actually more advanced than that photo now. And this is stuff from my garden in that tray. So what we've done at home is eat a plant-based diet. I try to buy local all the time. And we've got markets, local farmers markets every couple of weeks. And try to eat sustainably. So eating less meat and reducing plastic waste. Next slide. And so these are my pets. These are my 4 chickens. So the 3 Isa Browns and the 1 Australthorpe, and that's Goose, my guinea pig. And this is another view of my garden. So now what I've done also, you can see the corner of my water tank in the last slide. And this is my produce. So these are my tomatoes, my chilies, which are there all the time, the grapes from my grapevine and my oranges. So it's actually, I've been really, really lucky that I have joined a permaculture group as well. My neighbour is a permaculturalist. So we kind of share our garden tips and we actually share seeds, and it's my hobby. Next slide. And I've been lucky enough to have the option to actually have my panels and battery at home, and also my electric car, which was in 2019. And now I have been, not everyone has the option of doing this. And this is why I do my advocacy, because we need to transition and decarbonize our economy from our travel, from our transport to our home. And everyone needs to have the opportunity to do what I've done, not just me. And this is why I'm in advocacy, because if we allow the markets to go ahead, people will be left behind. Next slide. And this is my group, Doctors for the Environment. Okay, that's the end of my PowerPoint.
Wonderful. Thank you very much for sharing all of that. It was very comprehensive, and I really liked your solution breakdown into all of the various things that we can do. So thank you very much for compiling all of this. And I had a couple of questions, Dandenong specifically, and I'm sure you experience this in West Sydney as well. 70% of the 170,000 people within the Dandenong Shire Council don't speak English as their first language. And, just maybe you could share a little bit on how we can make some of the wonderful solutions and some of the advocacy groups and things like Market Force and, reducing plastic and encouraging community gardens and all of the amazing things you've just been sharing. How do you think that we can break through some of those cultural boundaries, especially in Dandenong as an example?
Okay, so what we have in Sydney is the Sydney Alliance, which is a group that works with the different cultural groups and the communities and non-English speaking communities. And I've been involved and worked with Sydney Alliance as well. So we have table talk evenings where we bring members of each community group to actually talk about solutions for the community. So Sydney Alliance is actually asking for solar projects related to social housing and tenants. And so you need to actually, when you advocate for certain things, you need to have really concrete asks in terms of what you want from local and state government. So the other thing I'm working with, and our councils are working with in terms of heat solutions, is for heat shelters during hot days. So I'll have to tell my daughter, Sydney, too loud. So we're working with, because we have a community of Western Sydney councils called Westrog. And so we're working to the council in terms of looking at ways to protect the community. So it is planting more trees and having greater shelters, changing the way we build the environment so that we have playgrounds that are safe for children. Putting out the message there, because it is a complex area, because you kind of have to look at everything at once. And I'm lucky enough to actually be able to work with all levels of communities within my own community and have my own advocacy group.
Yep.
And really, you do what you can. People will find their niche within the group. And what we do is try to, within Sydney Alliance, is to educate the community leaders within each community so that they can actually talk to their community about the solutions.
Yep.
So it's really, community work is so important. I can't emphasize how important community work is, because this is how we're going to change the system. We have to change the systems at all levels, but we have to, in order to bring the community has to understand what the problems are.
Yeah.
Because people do sometimes live their lives where they're kind of not aware of stuff that's happening around them, but kind of have a degree of acceptance about the heat, even the smoke, that they are powerless to change. So they don't take the potential steps that could help the community with the solution. So it's to empower the people within the community so that they understand the problem, and then have solutions that are doable, that are tangible.
And how do you think, you mentioned the safeguarding, having a safe place people can go to in extreme weather events, but what would be another example of, affordably being able to, whether it's in the winter months, kind of prepping for the upcoming heat season, especially if you're dealing with older people or some of those 6 at-risk categories that you shared. What are some examples of ways that we can encourage members of the community to safeguard, especially those at-risk groups, for the upcoming heat season?
So it has to work on all levels. 90% of people will see a general practitioner in 1 year. So it's actually getting our general practitioners to also have plans for their patients, because each person's an individual. Each person has different medications and different risks. So we have to know where the patient lives and what connections they have with the community, because we know that for heat, isolation is the biggest risk factor. So if you're isolated, you're more likely to die. So this is why community cohesion is probably the most important thing. And so we know that if I have a patient I know lives in a house that can't be air conditioned, you look for places. You say, do you have a relative you can stay with on days that it's hot? So within our Blacktown area, the council has found, because they've received funding from the EPA, some shelters for people. So we have church halls, shopping centres, pools, libraries that are open longer hours. Like our shopping centre opens for 24 hours on hot days, so that people can actually go there. So, and my trouble is that if it's a heat wave, you can't sleep there. So it is a problem, and the problem is heat is still not recognised as a crisis at a federal level. So even if you look at our federal government website, it says seek advice about how to deal with a heat wave, but no concrete measures on how to protect the population. And most areas within New South Wales don't have a heat plan in terms of how to protect the population. So it's actually acknowledging the problem and seeing what the potential solutions are. And part of the solutions are to solar panel all our social housing, all our rental housing. And this is part of the reason we have the Sydney Alliance is advocating for this, so that people can actually turn on fans and air conditioners on hot days. So it requires a whole of community response. I know this seems like a little bit of a impossible thing to do, but we almost have to do the impossible in order to survive this climate crisis. And so if we can,
and that's really what moments like the Forever Fest and bigger systems at play, like the Sustainable Development Goals, off bank number 1 is no poverty. That's
right.
That's not an easy thing.
And we are a rich country. We can actually do that. If we actually took all the money that's got funneling into fossil fuels and put it into clean energy and put it into councils so they can help our community, people shouldn't have to live in poverty in Australia.
No.
It's so this is why I'm so active at all levels of government with advocacy, because if we have the money to do some of the things that I mean, there's so many areas of need. Really, there's so many areas of need that actually need money, but this is an existential crisis unless we actually do adequate mitigation and adaptation. I've said a few times that Western Sydney won't be livable because it's so hot, it gets flooded, there's smoke. The built infrastructure is so important. So, I mean, we have to work with, this is why we still have to work with the state, because the Department of Planning, our councils, because we have to work in an integrated way to build houses that are safe for people to live in. So it's enormous what needs to be done.
It really is, but I think we've got a couple of questions that have rolled in, and maybe we could start with, on a local level. How can we kind of bridge the gap, and do you have any recommendations for strategies to have people engage with local councils, because they really are the sticky glue holding all of our municipalities together, And, Diane mentioned as well here on the comment, for a lot of people, I don't think it's culturally appropriate to actually put your head above the parapet to be engaging with your political leaders. So do you have any ideas on how to break those silos and encourage that hopefully not just one way of the community reaching out to the council, but how can they be that reciprocity of the council also engaging back?
So it really depends on your local council as well. So with it's really joining a group is probably still the most important thing. So I'm in Hills for Climate Action. The local of Blacktown is Cool Down Western Sydney. Find a group, join a group. How do you find a group? Sometimes there are community pages. A lot of community have community Facebook groups, and it's really find your tribe. And this is why Sydney Alliance is working so hard in the area of finding different groups they can engage with. So you can't do it in isolation because it's too scary for most people. Like I've been doing this for 6 years, so it's not scary for me, but it is scary because Australians aren't brought up really, even people who've been here for years and years and are second or third generations don't exercise their democratic rights in terms of engaging with the politics of it. But we have to remember these people are there to serve us. These people, the people who are in politics, in any level of politics, are there to serve us. So they really need to listen to what we want. And it does actually, it takes a group to do this. So like groups that are in every single electorate in Australia, there's Australian Parents for Climate Action. So I know there is Australian Parents for Climate Action in every single electorate in Australia. So that's one group to join. And there are, I hear that Dandenong has multiple groups though. Is there multiple groups for a lot of things?
I'm not too tied into the specificities. Maybe anyone else listening, Lily or any of the other team could voice that. But from our launch yesterday, I did see, that their greening component is impressive. They've got 100% electric buses going on. There's definitely, an increase in engaging the community. And I think that the gap right now is, just getting more trust within local councils, because I think a lot of people whinge often about councils, and yet they're the ones holding everything together with taking the trash and making sure the roads are clean and keeping the lights on. So I think there just needs to be more trust created. And we can definitely follow up with your question and add all of the current advocacy groups within Dandenong. And hopefully they can be more cohesion between, the hundreds of different councils around Australia, and they can be more of a current between them, because I think as a blueprint, councils can bypass national and state processes, because they obviously are bound by that governance, but they do have wiggle room to be relevant to their own culture and their own municipality that they're governing. So I really do feel hopeful that the councils can help leapfrog some things in Sydney. And I'd love to just go to a bit of a bigger scale, within the Climate and Health Alliance and what you've seen in the Doctors of Environment Australia. Do you have any big policy examples that are being pushed right now, that are hopefully going to be disrupting and leading us into a bit more of a sustainable future, especially when it comes to well-being, community engagement, and really talking about what we're discussing here today? Have you seen any bigger policy action going on?
So Doctors for Environment is specifically doctors. The Climate and Health Alliance is an umbrella for the entire health sector. In terms of, we basically have social workers, dentists, psychologists, so it's a bigger umbrella of groups. So what we are focused on numerous things. So with in terms of our health sector within New South Wales, the energy is still sourced from fossil fuels. So we are, and 7% of our emissions are from the health sector. So like 4 weeks ago, we went and saw the health department, because within if we take the example of the UK Health Department, they've actually saved $8 billion by actually making their healthcare more sustainable. So they were at 7% and now they're at 3 or 4%. So the way they started was that they had sustainability unit within their health sector. So what we're advocating for is a sustainability unit within the Ministry of Health that looks at all the different areas of health within New South Wales and all the local government districts of health, because things are being done in a patchy way within New South Wales for health. And so if we can't actually get our act together as doctors to reduce our carbon emissions from our hospitals and our health sector, that's also not a good thing.
Agreed. In infrastructure as well. I mean, there's
Yes.
another 3 billion being put towards roads and trains with that recent allocated budget, and how much of that is going to be decarbonized? How much of that is going to be,
I know.
unique?
So it's really also transparency, and it's a big document, but it's really we know that decarbonizing our transport is really important, because if you look in terms of how much transport has increased, I think it's 40 to 60% since 1990 in terms of transport emissions. And so the energy emissions for New South Wales has almost plateaued because of all the number of panels on people's roofs. So it's homeowners who've actually reduced our energy sector carbon pollution. But with our transport sector, it is terrible, because our fuels are number 65 in terms of how pure they are for our transport sector. We have got the most energy inefficient cars in the world, because of the fuel. It's got more sulfur. So our cars in Australia are more polluting than cars around the world. So our air pollution from motor vehicles is terrible. So even decarbonising the energy sector for transport is so important. And that's very, very slowly starting to happen, but it's not being really supported by any level of government.
And we're the slowest adopters for electric vehicles as well.
Oh, absolutely. Yeah, because there's no policies to help this along. I mean, they're going to put a tax in it on the Victoria. So,
and we've got a couple more questions here. And I think that this is a very relevant one from Alex. That, a lot of what we're talking about, especially the first section of your presentation, is a bit, doom and gloom, Al Gore teetering on his ladder, like, judgment day is coming almost, we are in the kind of, razor's edge of really deciding the next 100 years, in the next 10 years or so. But how can we make this conversation inclusive, and how can we, make it hopeful and accessible for people who are scared, who do often feel paralyzed, that as an individual, they don't have that autonomy and don't have that platform to create action? Any advice on how to keep that hope when we're engaging, whether it's our council or even within these advocacy groups, or even within friends or colleagues who might not be agreeing with what's happening with our world?
So it is really hard, because when you actually read the data and the tipping points, it is depressing. And we do have a generation of children who really understand the problem and see that adults are being active. So we know from studies that if you are sort of living the solutions within the options you have and advocating in a group, because being connected with other people is probably the most useful thing for mental health. Like for me, it's gardening, but it's the connectivity with other people. So when you feel alone, it's important, because when you're in a group, people look out for each other, because people are going to actually be depressed at one stage or another. So it's really community cohesion for the mental health, because people are being depressed for real reasons and not an imagined reason, or anxious for a real reason. So
do you have any advice as well? And I remember Steph and Grant during a previous conversation, that Steph was mentioning on the chat, that when she engages with some friends who are struggling with depression or struggling with climate anxiety or any of these things, that it kind of triggers, it's the age-old thing, telling someone who's really pissed off to calm down really never works.
No, go into nature. Do
Yeah.
things that engage with all your senses.
Yeah.
Go into nature, go on a bushwalk, go for a swim in the ocean.
Mm-hmm.
It's really like, if you connect with the natural world, it's really, really important.
Yeah.
Go with your friends for a bushwalk.
Mm-hmm.
Like with me, I just go gardening for 6 hours, or it's really connecting with this earth. And really, I think the problem is that with our First Nations, and I should have mentioned our First Nations earlier, their connection to the earth is, so the earth is really a part of them. And the rest of us have lost connection to this earth and really caring about this earth. So you can't really fight for something you don't love.
No. And do you think that, just while we're on the mental health, this is Mental Health Week, and I'm making an effort to wear fluoro, even though it's slightly washed out.
I know I'm wearing all black, but anyway, I've got a bright background.
Do you have any kind of advice for things to be smart about? Because for me, I'm seeing a lot of young people. One of the biggest things I get traction with when I'm talking to young people is to be like, we've got to make boundaries with this stuff. When you wake up, keep your phone on airplane mode for 10, 15 minutes. Don't go straight into scroll land. And before we go to sleep, have that space to turn your phone off and either just sit with yourself, read your book, being quiet. And whether it's how we're engaging with technology or anything, do you have any tips or tricks just to contribute to, the mental health thread that we have been talking about today, on how, just generally, what we can broadcast to make this conversation a bit more accessible and solutions oriented?
And yet again, it comes to connection. It does. So it's like with kids, I've got 2 kids, 121 and 117. So they understand this crisis as deeply as I do. And it's keeping the conversation going, being open, and because why do people it's a very complex reason why people become more depressed. I mean, and there's all sorts of societal reasons why people are more depressed, and structural reasons within society why people become depressed. And this adds on top of it. So it's community connection. I mean, it's still connecting with each other and with land. I can't think of anything else that's really helped me and helped my friends, is connection with land, connection with each other.
Yeah.
And it's really also, the other thing is that we're in a society, there's a book called Consumptogenesis. We're in a society where the marketing of society makes us think we need things more than we really need. Is to want less and to live with less. So it's really, I can see another question. It's really changing the way we think of life, and even the way the economy runs, to have a circular economy so that we don't have all this waste. So
I remember in Singapore, I was chatting with a group of children, well, not children, they were high school students, and they all looked very fatigued and very tired. It was exam time. They looked like a bunch of Wall Street bankers. And I remember one of the young gentlemen stood up and he's like, what's the parallel between circular economy and self-realization? And I was like, this guy, he gets it, because fundamentally, whether it's circular economy or dealing with that process of self-realizing, which nature and connecting to country and ocean really can provide, fundamentally, we start to not always seek what is outside of us, especially from a circular economy perspective. You're not looking for virgin resources. You're closing the loop, using things that are already out there. And when it comes to mental health, I believe that we need to look a little bit less from outside, even though engaging with the outside world is crucial. It's how we navigate life, but it's taking that moment to realize that we don't necessarily need more. And that self-realization, self-reflection is a really big part of being happy and having a healthy economy as well.
So it's like, at the moment, even with there's so many things are made so the end point is waste, and in a way that, just think about, depletes your soul. If everything has a full life and then returns at some stage to being something else useful, then even sort of thinking in a way that's regenerative on how you think about. So this is why I focus on a positive narrative. And a positive narrative means living with less, being less of a consumer, growing your own stuff, swapping with people around you, connecting with your neighbors, forming a society, because not everyone has to understand climate change to actually behave in a way that's good for climate change. Like I've got friends who are gardeners who don't necessarily believe in climate change, but they've got chickens, they grow their own food and they sew their own clothes. You don't need to convince everyone.
No.
Like even saving money by thrifting, because it's fun to find something for $5 that you would normally buy at 60 otherwise. It's like a fun thing to do.
And coming back to your sector, because while we're just still on waste, Diane McGrath is really leading the way in Australia managing our waste. And her question was, what is our health sector doing to reduce waste? What are the main things that we can do as residents and patients? And, especially with the single-use masks and, everything needing to be extremely sanitized. Is there some policy? Are there some motions around the corner that are dealing with clearly a big amount of waste that's being produced from our health sector?
No. So this is why we're, especially with COVID, there's been a lot more waste generated. So this is why we're seeing we've been advocating to the New South Wales Health for a long time, the minister, their staff, the people who work there. We have a lot of our members who are part of the bureaucracy of the Department of Health. And there are individual hospitals are doing good things. So I can point to a lot of hospitals, including in the Hunter Valley, where they actually have really reduced their waste. And they're trying to find a way to actually not use the power plant that's for New South Wales Health, which is coal, to go renewable, but there's a blockage there. So no, there is no plan federally or at state to actually reduce the waste, and this is why we're in the health advocacy space.
And what are some good news examples that those few hospitals are doing?
So Hunter Valley, where they've actually looked at their waste stream, and they've looked at their I should bring that up, but you can actually look up Hunter Valley Hospital in terms of what else they've done, in terms of their even waste in the canteen area for the staff and patient, in terms of the food supply and their procurables. So they've done a lot of work in that area. With Climate and Health Alliance, they have an arm called Global Green and Healthy Hospitals. So there are a few hospitals within the health sector that are with that group. And where I work, we are sustainable. So I work in Riverstone Family Medical Practice, and we've got a large water tank underneath our practice. We've got solar panels and we've got batteries. And we've got a building that's built to maximize natural light and reduce energy use. So there are a few other general practices that actually do the same thing. And that's because the people who work there understand the problem and do it. There's nothing global that's happening with general practices. So we're also looking at ways for whether we can accredit hospitals, but you have to work on another arm, because hospitals and general practices have to be accredited every year. Whether we can look at a way of whether the accreditation has to look at the sustainability component as well. So no, we're working on it. So there's nothing global at the moment.
Do you think that there's space for a lot of this, a syringe or a mask, or, a lot of the single-use items that are needed? Do you think that there's a space to be looking at not necessarily biopack substitutes, but, plastics that are made out of non-virgin materials, or plastics that are made out of hemp or CO2, or, non-hydrocarbon plastics, basically?
So this is an area that, because it's not just even waste, it's the procurement of the drugs, where drugs come from. And it is a whole big thing, because the procurement of drugs is one of the big factors as well. So during the crisis, we just realized how globalization limits things, because this is outside this range of this talk, but a lot of drugs became not available. A lot of those ampules are made in India. So we can see where single drugs are made in different countries. And then we had shortages of drugs because countries were in COVID. So we're in a system where globalization has not been a good thing in a way for the health sector. So it's all really complex in the health sector. That's why when we actually advocate, it's really for the low-hanging fruit, for the energy source for the hospitals, because
with the way that the synthesis of drugs is going, do you think that there's an opportunity there that Australia could be creating more of a vertical supply chain with certain elements?
Well, it's really up to government and industry whether they're going to actually do that.
Are we capable of it though, you think?
Oh, probably have to ask someone else, not me.
Well, maybe coming back to the kids, I know Alex 10 minutes ago asked, do you think that there needs to be more solutions in schools? Kids seem to be the ones having the conversations, leading the way.
So besides that, a lot of those school kids are now at a voting age, as in like everyone has to register to vote. Not all schools actually have good ways of dealing with kids with anxiety with climate change. And so it's I should get my daughter to talk about this. She's over there. That's all right, hon. So kids need to see that there are solutions, because that's why I kind of put out this Facebook post yesterday after the school strikes, that we all need to write to our local members about what's impacting us now and what solutions we want to see. Because unless we actually engage with people who actually are the decision makers, they don't know what we want. Because when I've seen politicians in the past, and I talk about climate change and the things we need to do in terms of adaptation and mitigation, they say, oh, my community doesn't care about it. Like, their community doesn't care about it. So in order for those guys to change, they need to see that community cares about the problem. So that's why if all the relatives of all those kids, like in Sydney, we had a huge turnout. And if the kids, all their family and their friends wrote to their local members, they'd get a deluge of papers. But it's so easy for the media to ignore a large crowd. They just don't show it on the news. But that's why snail mail is still really useful, because a lot of organizations do bulk emails, but it's actually a lot of politicians and their staffers just ignore bulk emails. But if something's physically in front of them, you can't ignore it. It's there.
I definitely agree with that. 10 handwritten letters are better than 500, online clicks.
Yeah.
And do you think that young people, we need to be even, 5, 10, 5, 7, 8-year-olds, somewhere in that bracket? Do you think we need to be talking to them, not as adults, but a little bit more seriously? Because I've often seen people on stage talking down with children with them,
So the thing is that kids kind of under the age of 7 are really concrete thinkers. Okay, they're not at a developmental stage where they can see sort of the event and the consequence. They don't have the ability to do that because they're not cognitively there yet. And there are good people who deal with this area, so that it's really, with little kids, you just get them connected with the nature. Okay, this is where people's love of nature comes. They come when they're little. So really connection with the garden, connecting with the land. So you start with little kids connecting the land, and then if it's a day where it's really polluted, you can point out the problem. Active transport's really important, so you can get them to appreciate active transport. You don't really need to present, because they're not at a point where they can cognitively understand that the consequence, but you can get them to appreciate what's good with the world and what they can do at their point. Like, we're going to catch the bus today, we're not going to drive, because so we add less smoke to the air. So really simple.
I really like that. And I think we've got time for maybe one more question. I can't see anything else in the chat bar, but maybe just ending on a really positive note. and there are a lot of negative things and challenges that we're going through, but what's an opportunity that you're feeling very hopeful about within Australia over these coming years?
Now, I've been in advocacy for kind of 6 years, but aware of it for the last 10. This is more people who understand than before. So like Australian Parents for Climate Action didn't exist 3 years ago. Now we've got 14,000 members. So more people understand and there are more voices for change. So the other good thing is that there are lots of areas where good people are actually running for political offices now. So there's in different areas, there's voices of groups where if you're not happy with your local member, you put someone there who you'll be happy with. If you can't change your mind of your local member, vote for someone else. And a lot of these table talk voices of groups are actually getting people we want. If you look at Helen Haynes, she arose from Voices of Indie. Okay, look at Zali. So she came out of, she's an independent who voices her community's concerns. There's several sort of independents who are really good. So it's, I mean, we really need to change the system and move the system along. And if we can't actually have the people there at the moment, we need to change the people in the system in order to change the system.
Yeah, well said.
So if you think you can run for local council, and my local group is going to run for council. This is my local community group. So you put people there who care about what you care about, and because most people don't know who's in their local council.
Yeah.
So we have the opportunity to change the system, although in Australia it's very slow because our wealth in Australia has come from the extractive industries for fossil fuels. And this is why we're so tied to it, especially in the eastern states. But so if everyone on this call could go and join Australian Parents for Climate Action, that would expand our group. And we are a wonderful group of parents. So
well, you've definitely shined bright on this call, and thank you very much for sharing your space between your busy Sunday, no doubt. And thank you for sharing your photos of your garden space as well. I live up in far north Queensland and got a lots of fruit trees and chooks and the whole shindig. So I really appreciate you sharing your beautiful backyard and all the bounty back there. And yeah, thank you just so much for sharing your journey and all of your knowledge over 30 years in the field. So really appreciate that.
Okay.
Wonderful. Well, thank you very much.